When you purchase your Wells Johnson HVP unit, you'll find the following components in the package. The canister, of course, which is sterilizable, autoclavable. The vibratory tissue separator, which is the vibrating table. The pump unit itself, and all the accessories that you'll need, including cannulas, foot pedals, power cords, etc. Included with the HVP system will be your 3 harvesting cannulas, 3 re-injection cannulas for the fat, the power cord, 2 foot pedals, a polycarbonate stabilizer plate for the canister, a gram scale, and the user manual for the unit. When you first turn on the unit, you'll notice the settings on the screen are preset to 9 psi, 75 RPMs, and 150 ppms. For the pulse setting, we want you to have this turned off at all times. For the pressure limit, it's suggested to increase to 13 psi. And for speed, of course, is all personal preference, but I suggest starting at approximately 150 RPMs. When you begin the procedure, you'll have your canister sitting in this polycarbonate stabilizer on top of your vibratory tissue separator table. And at the beginning of the procedure, you'll have the vibration turned on ever so slightly. Once there's enough fluid in here to weigh it down, you can turn it up higher for the remainder of the procedure to help separate the fat from the fluid. Before you start suctioning fat into the canister, attach the HVP tubing with a Y to the base of the canister. This will prevent the fat from freely flowing out the bottom while you're suctioning. Make sure and clamp these 2 clamps, and then you can thread the HVP tubing through the pump and the pressure sensor. Once it's threaded through, you'll want to zero out the machine to bring the PSI back near 0. To start the setup for liposuction into the canister, you'll need to attach 1 aspiration tubing to your aspirator on the vacuum side, and 1 aspiration tubing to your cannula, the patient side. Once you have finished suctioning the fat into the canister, and the procedure is finished with the liposuction portion, you can proceed to drain the fluid, which is collected on the bottom, out of the short end of this Y tubing. Once the fluid is finished draining, you can close that side off, open up the other side, and immediately start injecting fat using your re-injection cannula, operating with the foot switch. If while injecting fat you encounter a sound that represents grinding, similar to that, the reason is because we've built in this pressure sensor and the tip of your cannula has reached the PSI threshold in that particular part of the body. So to correct the grinding, take your foot off the pedal, move the tip of the cannula, and continue as you were. One other problem that we have had doctors encounter is that they will get a stoppage in flow of the fat. And one reason for that is a fibrotic buildup at the base of the canister. And the way that many doctors have solved this problem is by clamping off this tube, using a sterile syringe, and forcing air back up through this short end of the tube to move the fibrosis out of the opening of the canister. Once the procedure is finished, you'll take apart the canister by removing these 3 knobs on the top. Then you can slide the rods out from the bottom for sterilization. Also, the top and bottom come off, leaving you with just the plastic tube, which will be autoclaved at a different temperature.